Thank you, Mr. Speaker. In Budget 2016, our government committed capital investments for the Misericordia over 4 years to improve care for patients accessing the emergency department. This funding is long overdue, as more than 51,000 patients visited the MIS emergency in 2015-16, double the capacity of the 48-year-old facility. Construction of the new department is set to begin by late 2018 after the project's scope and competitive bid process are finished. Can the Minister of Health please update the House on where we are in the process and if construction will begin on time?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker, and to the member for the important question. Alberta has the fastest growing economy in Canada, as we know, and things are looking up in Alberta and in our capital city. Growth means more pressure on our older hospital facilities, made worse by years of neglect and budget cuts under previous governments. Albertans can't wait for important services and infrastructure. That's why our government's making investments that matter. Planning and design are well underway, and I'd like to thank this specific member for his advocacy in this area.
First supplemental.
Thank you, Mr. Speaker. Can the Minister please share with the House how this investment will improve the care for those in my community and communities across this province?
Honourable Minister.
Thank you, Mr. Speaker. It means shorter wait times and better access to care for patients across Edmonton and Northern Alberta. This is the first major investment in the Misericordia's emergency department in nearly 3 decades. It's shameful how Conservatives operated in Alberta. When times were bad, they cut services for Albertans. And when times were good, they cut taxes for the richest of their friends. This government is different. This government's protecting the services that Albertans count on.
Supplemental.
Thank you. Can the Minister of Health reassure the community that these improvements to the emergency department will not interrupt the services that people require while the Misericordia is under construction?
Honourable Minister.
Thank you, Mr. Speaker. The Misericordia Hospital is absolutely critical to the emergency room services that we provide in Edmonton and to folks from Northern Alberta as well. About 50,000 Alberta patients go to that emergency room every single year. While we make improvements, that won't change. The new emergency department will be built strategically to minimize disruptions. Patients will still get the highest quality of care without compromising ambulance access or the needs of the frontline staff who are there. Unlike Conservative governments who knew how to cut, we're building for the future, strengthening the care Albertans rely on, not cutting, we're building.
Yeah.